Is there a process for students to report to the university if they do catch COVID-19?
So it's important to understand the university itself does not have the legal authority to actually require a student report to us. And that is the same thing that's true of an employee. You know, in a message I sent out yesterday, we did ask for folks that if they do test positive to tell us. However, the authority, if you will, responsible for that reporting are actually, in the case of New York State, the county health department. So we do work closely with and in a sense rely on the county health department to notify us if there is an SU connected person that tested positive, and if there is then a risk of potential exposure to other SU connected people as a consequence. You know, so one of the things that is true is if an employee doesn't necessarily notify us or a student doesn't necessarily notify us, but there is no risk to any other SU connected people as a function of that positive test, it's likely that Syracuse University will never find out. But we can count on the fact that whether it is a student that's here in, for example, Onondaga County, or a student that's somewhere else from the country that had recently been in or around or on our campus, that health department that is responsible for COVID-19 response in that area would notify the university if there was a risk of exposure. But if there is not a risk of exposure, you know, if let's do a hypothetical. If it was a student who tests positive today, but that student has not been on our campus or in a classroom, et cetera, for 4 weeks, the only way the university would even find out is if that student voluntarily told us.
And that's basically the same process, or is it different for SU abroad students?
It is the exact same process, and to be clear, it's the exact same process at every college and university, because it is a violation of law for us to ask those kinds of or I take that back. It's a violation for us to require that folks would necessarily inform us of a positive test.
Okay, and so when if students have reached out to you about whether or not they've tested positive, are you guys required to tell anyone at the university community at large if there's not a risk of exposure?
If there's not a risk of exposure, I would argue it's even a violation of that student's privacy for us to necessarily make. The only reason we would make notifications is if there was a concern that other students or other faculty or other employees were at risk as a consequence of that other individual's positive test.
And that report.
Otherwise, it's just gossip.
Yeah, that's true.
Yeah.
And that reporting process, who should a student, if they have it, go to first if they want to notify the university?
They should go to the health center. My recommendation is you know, the doctors at the SU Health Center, Dr. Nardella, Dr. McCall, are really leading our response with regard to, because the other reason we would like to know is we want to reach out to our students and make sure they're okay. You know, it has less to do if there's not necessarily a risk. That's not to say we don't want to make sure our students are doing okay, that their families are okay as they navigate a positive test result. So the extent to which we can reach out and provide resources, et cetera, we want to be able to do that. That said, we can only do that if we know about a positive test.
Okay. And are you able to share basically like a general estimate about how many Syracuse University students have potentially tested positive for coronavirus?
I don't know that off the top of my head. I mean, between you guys and the Daily Orange, you're doing a pretty good job of reporting those tests almost as soon as we know them. The majority of them have been students that have come back from SU abroad, as I think you've seen.
And what are some of the resources that you're offering to students who are either going through difficulties with their physical health with this coronavirus pandemic or with mental health difficulties? Because it is a very stressful time, like globally.
Yeah, absolutely it is. I think again in the message that I just sent out, the days run together, I believe it was yesterday. One of the things that we're really focused on is how do we build a positive, supportive student experience now that we've made this transition to a virtual world, and we have a lot of smart, creative people that are working on building this community, this virtual community um, that includes not just students but our faculty as well. Part of that community are the types of resources that you described. So many of the Barnes Center, if not all of the Barnes Center counseling resources, mental health resources, et cetera, have transitioned to that virtual world. The opportunity for counseling still exists, and certainly within the schools and colleges in the academic enterprise, there's a big push on creating supportive academic resources that can be delivered in a virtual or a non-place-based way. So it's a big focus of our efforts right now is how do we continue to bridge and create connectedness in the community. Your point is well taken. Matter of fact, just this morning, we're very connected to the county's emergency response center, for example. So we now have an SU employee who is in the county's emergency response, and one of the things that employee shared with me today, which is troubling, is that the call center that the county of Onondaga has created for citizens who are struggling with various issues related not just to COVID directly, but all of the other consequences, the order to stay in your home, the order not to be out, are increased call volumes of folks who are thinking about harming themselves, or who are also calling about domestic violence issues, and all of this is a consequence of this new normal, of this shut-in, of this lack of human connectedness. And I think that's really a big focus of our effort right now, is how do we build that connectedness inside the Syracuse University community.
So going back to that point on mental health, Barnes Center, they now have a lot of virtual services. Are many students taking advantage of those services that are being offered online?
I think they are. Matter of fact, last I heard, the actual case count in terms of counseling appointments, et cetera, was actually up from our on-campus, our residential experience. I have not had an update on that number in several days, but I know that it's been a very robust volume of calls into that center.
Okay, so in a statement that Provost John Liu sent to the, I guess, student body and campus community, he said that when we look back at this time, we're going to see some good decisions that were made and some bad decisions that were made. I know we're in the middle of it right now, but looking back right now, what we've done so far as a university, are there any good decisions that pop out to you? Any bad ones? Any ones that you're still unsure about?
Yeah, that is such a, as you can imagine, I reflect on that. I'm immersed in this now 24/7. It really is. That this will be one, if not more, chapters in the history of Syracuse University. That's one of those ones that the decisions we make are ones that will be long remembered, whether they're good decisions or bad decisions. I think our response, all else being equal, has been absolutely. There are things that when we look back, we're going to say, I wish we did this differently. I wish we approached this decision differently. But the challenge, I think, as an academic, I'm a Wooden professor by his appointment. I study decision making. I study people, how people process information and make decisions. And one of the things that intellectually for me, this is interesting because we are making decisions in an inherently unknowable future. What tomorrow brings relative to a global health pandemic, and how it's playing out in this country, in this community, and across the world, that changes hour by hour. So the challenge then, managing the situation for the university and all of the people who are working hard to do this, the decisions we make today are likely decisions that it could be in 48 hours. We will say, geez, if we had the information we have now, I would have done that differently. We would have made a different decision. But we have to resolve ourselves to the fact that the best we can do is make the absolute best decision on behalf of our students, our faculty, our community at the time with the information that we have.
So at the beginning of this, Chancellor J announced that you would be basically leading the response, or the university's response to coronavirus. Why were you put in charge of this response specifically?
That's a good question. I've asked myself that question. There are two vice chancellors here at Syracuse. I sometimes jokingly describe myself as the vice chancellor for things people don't know what to do with. I'm an entrepreneurship and innovation professor by academic training. Honestly, I'm also a former military officer. I spent 14 years in the military, and I think as a consequence, I think I bring to the role a sense of how to manage a complex enterprise in the context of a contingency response, if you will. You've heard the governor and the president and others, talk about this as a war against this virus, and I think that usually I am not comfortable with those kinds of comparisons, but in this case, the country's response is certainly very much akin to responding to a life and death situation with an enemy, in this case a virus that is out to do us harm. So I do think some of my background is relevant to actually putting a plan together for the university to respond.
Worst case scenario is that a member of Syracuse University, whether they be faculty, staff, students, administrator, they get the virus and unfortunately they pass away. How is the university prepared to handle that? And counseling with students and members of the community afterwards?
Yeah, that's you described it correctly. That is the worst case possible scenario. One of the things that I think we have rightfully focused on the health and well-being and the experience of our students, but it's important that we don't forget our faculty and staff in the context of this. And when you look at the data on this virus and the mortality and the percentage of folks that recover and manage the virus akin to the flu versus those that end up in hospitals and in some cases never leave the hospital, the majority of those are folks of a certain age category, 60 and above. And we have to think about the decisions we make relative to even transitioning online. Part of that decision, when we made it, we made in the interest of our faculty and staff, and the idea of potentially exposing them to the virus that they were exposed to in a classroom from a student. But I look out over this campus and it is empty. Our faculty are at home. The overwhelming majority of our staff are at home, and they're at home because it's in their best interest in terms of their health to be at home. I think we would have made this decision on behalf of our faculty and staff and our students and their health, even absent an order from the governor and the state of New York to do it. It was just the right thing to do.
So going back to some of the students, some students went away for spring break and some of them stayed in Syracuse, but there is a population of students living off campus right now. And in a presser from County Executive Ryan McMahon, he did mention that there are some students who they're getting calls about with violating social distancing. And I think in one of the coronavirus updates, I believe sent out yesterday, the university basically asked students to please start observing these social distancing rules and that there might be consequences in the future if students start to or continue ignoring these rules. Can you elaborate on the university response to that and what's the communication like between you guys and the county on this matter?
Yeah, so we're connected with the county every day. I will say this. This is a personal soapbox of mine, even beyond, the challenge is that we continue to see, posts on Facebook and other social media platforms about parties, et cetera. Don't do it. I think she thought it was a joke, but I mentioned to a colleague in student affairs, listen, I want names, and I want their phone numbers. I want their parents' phone numbers. The idea that a student would put someone else's grandparents, someone else's brother or sister, it's one thing to say, well, I will take the risk. I'm the one that is potentially at risk if I violate. That's not true in this case. It's one thing to say you're willing to take a risk. Are you willing to put someone else's family at risk? And the answer to that should be every single time, no.
How will fall 2020 registration be impacted by all of this? We can't go to the advising office. I know for a new house, waitlist forms usually have to be handed in person and filled out in person. Is the advising office and those in charge of class registration, what kind of adaptations are they making right now to make sure that this goes, I guess, as smoothly as possible?
Yeah, so that's a great question. And, it is, there is on one hand our immediate response to COVID-19. And then there is, on the other hand, what does this mean 3 months down the road, 6 months down the road? What does this mean for December 2020? We created a working group at the university whose job is to address exactly the kinds of questions that you just described. So in parallel to the process that I am running in terms of immediate response, there is now a second group that has been created that shares some members, if you will, between the two groups. What are the things that we need to set up and do now to create the virtual mechanisms that you described? So if in Newhouse the waitlist process is carrying a piece of paper somewhere, we can't do that right now. So how do we do that in the current environment? It was actually just the end of last week that working group was formed, and they're really tackling all of these issues right now, and contingency and building out scenarios for different versions of what the fall may look like as a consequence of where this virus is and where the country's response to this virus is in June and July and then August.
Is Syracuse University looking at cutting their abroad programs in the fall?
We're certainly looking at the future of our abroad programs. I don't think we've not made any decisions about canceling programs or transforming programs in relative to how they exist today. But that's exactly, that topic is one of the issues that this new working group that I described is tackling right now. It is in addition to our abroad programs, it's also looking at how we're going to support international experiences and international students more broadly than just the SU study abroad.
So what about international students that are coming from nations where they have like a massive high risk rate for coronavirus? They may have travel bans coming into the country. How are they potentially going to maybe even start their first year at Syracuse if they're not allowed to come to campus?
Yeah, this is a great example. I used the term earlier of having to make decisions in the face of an inherently unknowable future. This is a great example of that. It's hard for us even to plan when there are so many different scenarios. Travel bans, for example, it could be, I read of a test today, a new coronavirus test that will in very short order allow an individual to demonstrate that they've already had the virus, and as a consequence of already having the virus, at least the science right now is you will not get it a second time. So I bring that up to say there are scenarios that play out that say, well, maybe there is a travel ban, but only if you have never had the virus. So folks who have had the virus can travel. There's lots of different ways that this plays out. and we're just not sure. Some of these questions are, the answer right now, for better or worse, is going to be, we just don't know.
Graduation is still kind of coming up. The commencement survey was sent out on Friday. Some seniors had kind of mixed reactions to the survey form, but how is that survey input going to be used in the process of deciding what kind of celebration the class of 2020 gets?
It is going to decide what kind of celebration. This was another one, as I mentioned earlier during our discussion, that one of the things that myself and the team of people that are working with me, we're paying close attention to what other institutions are doing. And one of the things that, as we were thinking through how do we approach the commencement decision, one of the things that became clear is that we should not impose a solution on the class of 2020. We should offer them an opportunity to have a voice in what that solution is. And as we discussed that further, we went beyond offering a voice. We basically said, we're going to let the class of 2020 decide what it is we do. So hence the survey. Certainly, as you alluded to, there was feedback from students about words we chose in the survey, and this is a good example of we are doing our best, but not everybody's going to be happy with every choice we make along the way. But I think ultimately, when this survey closes out on Friday, I think it will be the graduating class of 2020 that decides how their commencement experience is going to be celebrated by the institution and by their peers.
So the survey closes on Friday. It's all basically going to be decided directly by the senior input. Does that mean by next Monday, we'll basically have a very vague plan of what we can expect graduation to look like for 2020?
I would think by the beginning of next week, the university will be in a position to announce publicly the results of that survey. I'm not going to commit to it's Monday, but by the beginning of next week, yes.
Really quick, is SU assisting in any coronavirus research right now?
What's that?
Is SU assisting in any coronavirus-related research right now?
Yeah, so I will tell you, when I was given this assignment by Chancellor Severud, one of the first things I did was actually reach out to 3 epidemiologists who work in the Falk School. They are public health professors in the Falk School, and I brought them over to my office, and we spent about 2 hours together. We have, hopefully it doesn't surprise you, some nationally known and internationally known experts in epidemiology and public health that are faculty at Syracuse University. Those faculty are engaging globally in terms of research. Those faculty are engaging locally. So Professor Dave Larson, who is one of those epidemiologists, is in communication with the county, as well as bringing back best practices he's learned from his peers to help us, as the county executive has taken to saying, flatten the curve here in Onondaga County. So absolutely, and I'll add to that, much to their credit. Speaking of the Falk School, I talked about the county's hotline that they've set up for social services, for mental health, and we have Falk School graduate students, and as well as staff from the Barnes Center, that are helping answer those calls from members of this community and provide counseling and social service support. So, one of the things for me that's been so rewarding about this experience is to see faculty members and staff members from across Syracuse University really step up and roll up their sleeves and get involved in this effort. We have professors from architecture and industrial design that are laser printing face shields for the local hospitals. And I think you saw a story. We have the costume shop at EPA is sewing face masks. I mean, how wonderful is that? So it really has been inspiring to see it happen.
So going on that, I guess, connection between Onondaga and Syracuse or University, we're hosting the Surge site at Manley Fieldhouse. It needs to happen. There were toilet roll pallets that were donated yesterday. On Monday. So what further plans, or is it just a day-by-day thing? Actually,
So every single day, a member of my team, Sydney Johnson, meets with Ann Rooney, who's the deputy county executive, and they talk through what needs there are in the community that Syracuse University could potentially support. There are lots of conversations going on right now. Everything from so a great example is a big need in our community right now. Is food service, if you will. There are now close to 1,000 folks in Onondaga County, elderly citizens, people with disabilities, et cetera, that can't readily access meals. So the county has set up essentially a volunteer service to bring boxed meals to these folks, but the need has become so great that the county is looking for other large kitchens where they can prepare some of these meals. So one of the things that we talked about last night is can we offer up one of the dining hall kitchens at Syracuse University as one of the sites that we can prepare these meals? Well, the answer is going to be yes. We just have to figure out how to do it and work with the county to make it happen. But these are the kinds of things that we've been part of this community for 150 years. This is an opportunity for all of us associated with Syracuse University to step up and truly demonstrate being part of this community.
okay. So all of the research about this virus, some of the, I guess, models about how it will end up, some of them are pretty dire, especially in regards to the pandemic potentially just still continuing as we head into fall. Is there any potential of the fall semester also being remote as well?
Yeah, again, I keep going back to here we are, we're making decisions in a future that we just can't predict. If you listen to Dr. Fauci and as recently as yesterday, I think he talked about a possible resurgence of the virus once the weather cools down again in the fall back in North America. I've heard similar discussions and other briefings that I've sat through with the CDC and the World Health Organization. I just think the answer is we don't know. But I also think, to frame this positively, I also think there will be a lot more we know about this virus and how to treat it, how to test for it, et cetera, in the weeks and months that come. So it could be while we're not through the virus and the spread of the virus in North America, let's say by the fall, that's not to say that our lives in the fall will be like they are right now. I think a lot will have changed for the positive as well.
Okay. Do you have an estimate about how many students are still left on campus right now?
I have more than an estimate. I get a daily report. So I can tell you we have just over 800 students who are right now still on campus in university housing. For their own health and safety, one of the initiatives that we embarked on beginning about a week and a half ago was to move all of those students to apartments in South Campus, individual apartments in South Campus. That was because we had residence halls, entire buildings that maybe had just 2 or 3 or 5 students in them. That's not safe. It's not safe for them. It's not safe for their mental health. It's not safe for their physical well-being as well. So we wanted to consolidate all those students in one place. So we've been moving them day to day, tackling different main campus residence halls, moving them all to South Campus. By the end of the week, all of those 800 remaining students will be with us on South Campus. And we've told them they can stay as long as they need to stay. This is a good example of a decision we made, back to an earlier question you asked, that we made ahead of many of our peers that I think was the right decision for us to make. And that is, instead of telling all of our students you have to vacate university housing and go home or go wherever it is you go, we took a different tack than a lot of our peers who did make that issue that directive. We told students that international students that can't fly home, or other students that really don't have a safe and stable place to go, you can stay in university housing as long as you need to. So we anticipate that some of those students will be with us on the campus in university housing all the way into the summer.
So throughout this entire response, I know there's a lot of just adapting to really just rapidly changing circumstances, but is there anything that's kind of guiding you all in this response, like a code of ethics or just a general kind of theme to it?
Well, I can't speak for everybody else, but I will tell you this. I was sitting in my office about a week ago, and I was listening to my music from my phone, and there's a song that you probably didn't expect a response like this when you asked this question. There's a song that popped on, and it was a song I'd never really heard before. And it turns out it was from the musical Hamilton, and the title of the song is "History Has Its Eye on You." And there's a line that, back to what I said earlier, I really think that this is one of those situations where the history of this university, history of this community will long remember the decisions that we make in the context of this response. For me, that's the lens that I'm applying to these decisions. Are we making decisions that that people will look back on and say that was the right ethical decision, that was the right moral decision, that was the right human decision in the context of our response? For me, that idea of hey, history will remember. So let's make sure that we're making a decision that 20, 30, 50 years from now, people will say they did it right.